I hope ECHO continues. I feel more hopeful about maternity care being transformed in New Jersey than I've had in over 20 years.
The MHI ECHO is really an impactful way to address some of the key issues that are underlying causes for disparities in maternal health, and that it's a way to really disseminate this information in an accessible way, in a non-threatening way, and that it's, clearly incredibly popular. If you look at how many people initially came and how the audiences are growing, it's something that is worth continuing.
Just the ability to have this place. We talk about interdisciplinary care, but we still are kind of operating in our silos a lot of times. So it's really, I think one of the major accomplishments is to see that in action and see that in work.
Providers who support families in Trenton saw similarities with people who are working with families on migrant farms in Vineland. It was incredible to see those connections being made that perhaps they would have never crossed paths before, and that was all because of ECHO.
There's really actually an infinite amount of people that we're reaching. If you think of pushing 200 people in the ECHO, and then those people are going out to their communities and they're spreading information and they are improving their practices and they're taking care of birthing people. The ripple effect of the ECHO is far beyond that core group of folks that are attending the ECHO.
And the ideas that we get from one another, how we pass that information on. It's amazing. Sometimes you would think, oh, this provider probably knows all of that. And then, in the chat, you'll say, wow, this is the first time I'm hearing of this. How are we really going to improve things if we don't continue on?
It's like an incubator. It gives some thought to how you can approach a problem, but you're not only getting your perspective, you're also getting the perspective of other people who are seeing the same problem from their lens. And, it could also be from a disciplinary lens, but also geographic.
I think there's an ongoing need for ECHO to bring together innovative ideas and people who are willing to be thought leaders and willing to share resources from their own professional organizations and say, here's a toolkit.
The Rutgers ECHO team was really open to our suggestions and feedback, and they worked closely with all 3 maternal child health consortia from throughout the state of New Jersey to make sure that our partners and our stakeholders were engaged and represented, and they were so open to any suggestions that we had.
It takes time for people to become comfortable and feel like that this is a space in which they can really contribute. And so I think that's happened and people are comfortable sharing in this community.
A lot of people, I think, even know me for being me from being on ECHO. I think it would be a big loss to our community if we did not have it.
It is something that has had such an impact on New Jersey and beyond. And I think that not funding this or not contributing to its expansion would be such a missed opportunity, especially in a state where we are battling high rates of maternal morbidity and mortality. It's so important that we continue to get the word out.
The issues that we have in healthcare have been centuries in the making. You're not going to see a direct improvement in a year.
We're not going to see that direct impact right away. But engaging, who are all the people that have to be engaged in this work? Maybe I'm not going to see it this year, but maybe I'm going to see it in 3 years and 5 years. But who am I going to engage to help?
The transformation of maternity care is not only clinical, it's also system-wide, it's relationships, it's transforming practice. That takes intentional design, and it can't be one and done.
Think of not having an ECHO. All the wonderful could have beens, or I never thought of that, they don't happen. And it's sad. Even with the wonderful work that we've done so far in New Jersey, we have so much more work to do, and it would definitely be a disservice to maternal child health community, to our providers, and more importantly, the community residents, to discontinue this.